Welcome, medical students, to our lecture on the diverse and complex world of sexually transmitted infections, STIs. We will cover epidemiology, clinical considerations, diagnosis, treatment, and prevention strategies for STIs. Let's start with epidemiology and global burden. STIs are a major public health challenge worldwide, affecting millions each year. They cause severe health problems and pose a burden on healthcare systems. Understanding their prevalence and distribution is vital for effective control measures. This topic discusses the global burden of STIs, emphasizing the need for prevention and treatment strategies on a global scale. Genital herpes, a viral STI caused by HSV-2, has recurrent episodes and complications. Diagnostic methods like viral culture and PCR, treatment options with antiviral medications, and preventive strategies like condom use and counseling will be covered. In this section, we will explore the human papillomavirus, HPV, and its link to various cancers. We will discuss the molecular mechanisms of HPV infection and the role of high-risk HPV types in cervical, anal, and oropharyngeal cancers. The significance of HPV vaccination in preventing these infections and the importance of cervical cancer screening will also be covered. 4. Syphilis, stages, diagnostics, and treatment challenges. Syphilis is a systemic bacterial infection caused by Treponema pallidum. This topic will cover the different stages of syphilis, including primary, secondary, and tertiary syphilis, each characterized by distinct clinical manifestations. Diagnostic approaches, such as serological tests, will be discussed in detail, along with the challenges associated with managing this infection, particularly in cases of antibiotic resistance. 5. Gonorrhea and antibiotic resistance. Neisseria gonorrhea, the causative bacterium of gonorrhea, has exhibited increasing resistance to multiple antibiotics, posing a significant global threat. This topic will explore the complex biology of gonorrhea, including its transmission, clinical manifestations, and associated complications. The rising problem of antibiotic resistance and the urgent need for alternative treatment approaches, such as combination therapies, will be emphasized. 6. Chlamydia trachomatis infections, ocular and genital manifestations. Chlamydia trachomatis is a bacterium responsible for both ocular and genital infections. This topic will focus on the diverse clinical presentations of chlamydia trachomatis infections, including ocular trachoma, neonatal conjunctivitis, and genital infections. Diagnostic approaches, such as nucleic acid amplification tests, NAATs, will be discussed, alongside treatment challenges, including the high rates of reinfection and co-infections with other STIs. 7. Mycoplasma genitalium, an emerging STI with diagnostic and treatment challenges. Mycoplasma genitalium is a relatively newly identified bacterium associated with urogenital tract infections. This topic will explore the identification and clinical implications of Mycoplasma genitalium infections, focusing on the challenges involved in diagnosing and treating this emerging STI. The importance of proper diagnostic testing and the potential consequences of untreated infections will be highlighted. 8. Human immunodeficiency virus, HIV, and acquired immune deficiency syndrome, AIDS, pathogenesis, antiretroviral therapy, and pre-exposure prophylaxis, PrEP. HIV remains one of the most significant global health challenges, with AIDS being its advanced stage. This topic will provide an in-depth understanding of the pathogenesis of HIV infection, including viral entry, replication, and immune evasion strategies. Antiretroviral therapy options for managing HIV/AIDS, as well as the use of pre-exposure prophylaxis, PrEP, as a preventive measure, will be thoroughly discussed. 9. Hepatitis B and C viruses, sexual transmission, clinical presentations, and management. Hepatitis B and C viruses, HBV and HCV, can be sexually transmitted and pose a substantial burden on global health. This topic will explore the sexual transmission routes of HBV and HCV, their clinical manifestations, diagnostic methods, and management strategies. Emphasis will be placed on antiviral therapies, vaccination programs, and the implementation of harm reduction strategies to reduce transmission rates. 10. Trichomoniasis, causative agent, clinical symptoms, and diagnostic approaches. Trichomoniasis, caused by the protozoan Trichomonas vaginalis, is a prevalent STI globally. This topic will cover the causative agent of trichomoniasis, including its life cycle and mode of transmission. Clinical symptoms and potential complications will be discussed, along with the available diagnostic methods, such as wet mount microscopy and nucleic acid amplification tests. 11. Bacterial vaginosis and vaginal microbiota, implications for STI acquisition. The vaginal microbiota plays a crucial role in maintaining vaginal health and preventing STI acquisition. This topic will explore the complex interactions between vaginal microbiota composition and the development of bacterial vaginosis, a common disturbance in this delicate microbial balance. The impact of bacterial vaginosis on STI susceptibility and the potential use of probiotics as a preventive measure will be discussed. 12. Pelvic inflammatory disease, PID, etiology, clinical features, and long-term consequences. Pelvic inflammatory disease is a serious complication of certain STIs, primarily chlamydia and gonorrhea. This topic will provide an in-depth examination of the etiology of PID, including the ascending infection of the reproductive tract. Clinical features, including lower abdominal pain, fever, and fertility implications, will be discussed. Diagnostic challenges and long-term consequences, such as chronic pelvic pain and ectopic pregnancies, will also be addressed. In conclusion, this course on STIs offers a complete understanding of their spread, symptoms, diagnosis, treatment, and prevention. Medical professionals must grasp these infections' implications and take proactive measures to reduce their impact. Keep exploring microbiology and infectious diseases.